The swan neck deformity that we'll discuss at the clinical part, my dear, and the boutonniere deformity and the jet deformity of the thumb, symmetrical polyarthritis of the small joints of the hands with the morning stiffness. What I said? Symmetrical polyarthritis. So this is the arthritis box, that the 1, 2, 3, 4, 10 and 0, 1, 2, 3, 4, 3, 5 minus. So if you write down immediately after that, you can make your score, my dear. Hello, my dear doctor. I'd like to talk a very important topic, my dear. Rheumatoid arthritis. Rheumatoid arthritis, rheumatology, my dear, is the main disease that you need to know, my dear. And rheumatoid arthritis regarding this topic, my dear, the exam questions hitting in each and every diet. So my dear, listen very carefully. In rheumatoid arthritis, the epidemiology, first of all, I'd like to discuss. Just follow me what is written in your notes, my dear. Epidemiology peak onset is a 30 to 50 years, although occurs in all age groups. Circle the 30, female-male ratio is a 3:1. So the female circle the 3. So it does mean the rheumatology, arthritis, the female disorders, my dear. Prevalence is 1%, circle the 1%, and some ethnic differences, high in Native Americans, circle the Americans, and associated with the HLA-DR4, circle the 4, that is especially the Felty syndrome, circle the Felty syndrome, my dear. So knowing these facts, sometimes 1 or 2 questions might be coming from here. So if you give a SS box onto the board, so that it will be helpful, my dear. So let me see the box that I've given here, the number 1 box, the rheumatoid arthritis epidemiology. So 1, 3, 4, 30 Americans, my dear. Just write it down, 1, 3, 4, 30 Americans. So what is say? 1, 3, 4, 30 Americans. 1, 3, 4, 30 Americans. 1 for 1%. 3 for female-male ratio is 3:1. And 4 for HLA-DR4, my dear. What I say? HLA-DR4. And next to the 30 is the age, my dear, 30 and Americans. And 4 for, once again, HLA-DR4, 4 Felty syndrome, 4 Felty syndrome, 4 Felty syndrome. So once again, 1, 3, 4, 1, 3, 4, 30 Americans, my dear. Knowing this box, my dear, it will be really helpful to remember all the facts that are encountered in exam, my dear. Next is the rheumatoid arthritis diagnosis. Yes, my dear doctor, listen very carefully. I'd like to discuss, before going to the rheumatoid arthritis diagnostic criteria, the new criteria, I'd like to discuss the rheumatoid arthritis definition, my dear. This is very much important. The rheumatoid arthritis, I'm saying, is a chronic progressive, yes, my dear, what I say? The rheumatoid arthritis, RA, is a chronic progressive erosion, or I call the rosing, my dear. Rosing means erosing disorder or erosive disorder. R for rheumatoid arthritis, R for rosing or erosion, my dear. You can say the rosing means the erosing or erosion, my dear. Means the rheumatoid arthritis is a chronic progressive erosing disorder, and that leads to the destructive disorder, deforming arthropathy. These are the 5 important words, my dear, you need to know. I am writing here so that you can understand, my dear. The rheumatoid arthritis is the definition, as I am saying, the chronic progressive rosing, my dear, destructive and deforming arthropathy. I have written here so that you can understand, my dear. So chronic progressive rosing, just write it down, R for rheumatoid arthritis, chronic progressive rosing, destructing and deforming arthropathy, my dear. So I'd like to discuss a little bit further so that you can understand. Yes, my dear doctor. So I'd like to give the rheumatoid arthritis, the word that you need to remember, my dear. So yes, I'm writing once again. The rheumatoid arthritis is once again, the chronic progressive rosing, destructive and deforming arthropathy. So I'm writing rheumatoid arthritis. Once again, this is very much important, as I have written. Yes, my dear. The rheumatoid arthritis, as I say, the single word, my dear, we need to remember that the erosing. But the most important talk is a chronic, and next is the progressive. Chronic progressive erosing, destructing, and deforming arthropathy, my dear. arthropathy. So this is the definition of the rheumatoid arthritis. If we are saying the chronic, what does is chronic really means, my dear? Chronic really means the disease starts at the age of 30 years. If your lifespan is 80 years, so if the disease starts from here, so the disease will progression, means it's a chronic disorder till the time of your lifespan, my dear. So this is a chronic, my dear. Chronic means the disease starts at the age of 30, so it will end up till the time of your death, my dear. So it does mean the chronic disorder. And progressive. Next is a progressive disorder. Progressive disorder means it's a progression, my dear. It's a progressive disorder. Means the day you are passing, the disease severity will be increase, a progressive disorder. So this is a progressive. And most important word, as I said, the rheumatoid arthritis, the R for rosing, my dear. I said the rosing, but it's a erosing disorder, my dear. So that you can remember, erosing means the disease passes, the bone erosion will be happen, my dear. So these are the erosions. The disease passes, means the damage will be happen, it will be erosion, my dear. So this is nothing but the erosion. So as I said, the erosion, my dear, you need to know this is nothing but erosion, my dear, or rosing disorder, erosing disorder. And the disease passes, not only they cause the bone erosion, but having some of the structures, surrounding structures, like the ligaments, that will be also affected, damaged, my dear. When the ligaments will be affected and damaged, this is called the destructive, my dear. What I said? The erosion is the bony erosion. When the ligaments will be affected, these ligaments will be affected, then this is called the destructive. Destructive means the surrounding structures of the bones, my dear. Is the destructive disorder, destruction. Whenever the bones and the ligaments, surrounding structures are damaged, that leads to the deforming arthropathy, my dear. Deforming arthropathy means the deformities. The deformities are, this is very much important, my dear. The deformities are, this is very much important, my dear. The swan neck deformity that we'll discuss at the clinical part, my dear, and the boutonniere deformity, and the jet deformity of the thumb, and the ulnar deviation of the wrist, my dear, both joints. So these are the deformities usually happen. So what I'm saying, my the box that you need to learn, that the rheumatoid arthritis is erosion, my the single word. What I say, chronic progressive erosion, my dear, destructing, deforming arthropathy. The single word that rheumatoid arthritis they need to remember, that the erosing, my dear, means the erosion, my dear. So yes, my dear doctor, so the rheumatoid arthritis is nothing but the chronic progressive erosing, destructive, deforming arthropathy. The deformities are the swan neck, boutonniere, jet deformity, the ulnar deviation. So you can write down the deformities, my dear. So before going to the diagnostic criteria, means the new diagnostic criteria, I'd like to say some of the important talks, my dear, the old diagnostic criteria. Yes, my dear. So this is very much important, and one of the important box that I'd like to say, my dear, before going to the diagnostic criteria. What is that? My dear, look at me. This is very much important. So what I'm saying, my dear, the symmetrical, say with me, symmetrical polyarthritis of the small joints of the hands with the morning stiffness. What I said? Symmetrical polyarthritis, small joints of the hands with the morning stiffness. Symmetrical polyarthritis, small joints of the morning stiffness, my dear. If the patient comes up with the symmetrical, means the both-sided small joints of the symmetrical polyarthritis, poly means multiple joints, but I'm giving one of the box here. Yes, my dear. The one means mono, P for poly more than 5, so more 2 to 5 is an oligoarthritis, my dear. So whenever the polyarthritis means the more than 5 joints is involved. So once again, symmetrical means the both hands. Polyarthritis means more than 5, P for poly, P for 5, polyarthritis of the small joints of the hands, especially the metacarpophalangeals, MCPs and PIPs, proximal interphalangeal joints. So yes, my dear, symmetrical polyarthritis, small joints in the hands with the morning stiffness. If the patient comes up like the 35 years old lady presented with the symmetrical polyarthritis, small joints in the hands with the morning stiffness, we should think about the two diagnoses, my dear, rheumatoid arthritis, single diagnosis. Second diagnosis, PSA, my dear, psoriatic arthritis. What I said, the rheumatoid arthritis and psoriatic arthritis. Now, how to differentiate? The differentiating points that you need to tell to your patient to show me your elbows. In the elbows, if you see the rheumatoid nodules, subcutaneous nodules, so the diagnosis is rheumatoid arthritis. In contrast, if you see the psoriatic rashes, so the psoriatic arthritis. So what I said, symmetrical polyarthritis, small joints of the hands in the morning stiffness, diagnosed RA and PSA. RA, rheumatoid, R for rheumatoid nodules, and PSA for psoriatic arthritis. PS means the psoriatic skin patches. So we can write a box here. We have already written here box that says box the symmetrical polyarthritis, small joints of the hands. Just write it down with the morning stiffness. The diagnosis, one diagnosis rheumatoid arthritis, the second is the PSA minor. For the rheumatoid arthritis, that you need to look for the rheumatoid nodules, as I said, and the psoriatic arthritis, the psoriasis minor. Fantastic. So you already learned the symmetrical polyarthritis, small joints of the hands in the morning stiffness, diagnosed RA, PSA, RA for rheumatoid nodules, and PSA for psoriasis. Now we'll write down the old diagnostic criteria. Rheumatoid arthritis, the old, I say usually the gold, my old is the gold. Morical 4/7, the diagnostic for the rheumatoid arthritis. So yes, the diagnostic criteria, already we have written the four important criteria. The symmetrical polyarthritis, small joints of the hands in the morning stiffness, the four criteria, plus 3 R, my dear. R for rheumatoid nodules, R for radiological changes, Roshan, my dear, and R for rheumatoid factor. So these are the 7 criteria. This is very much important. And definitely the symmetrical polyarthritis, small joints of the hands in the morning stiffness should be more than 6 weeks, my dear. It's said the old criteria, and that should be Morical 4/7. So you have the 4, and any one, yes, you can make the diagnosis based on the old diagnostic criteria. So 3R, once again, the rheumatoid nodules, radiological changes, Roshan, erosion, as you already learned, and R for rheumatoid factor, my dear. So these are the important criteria, the old diagnostic criteria. So yes, my dear, the boxes are really important. The rheumatoid arthritis epidemiology, rheumatoid arthritis definition, mainly the rheumatoid arthritis Roshan, and the symmetrical polyarthritis, small joints of the hands in the morning stiffness, RA, PSA, R for rheumatoid nodules, and PSA for psoriasis. And once again, the old diagnostic criteria, there is nothing but the symmetrical polyarthritis, small joints of the hands in the morning stiffness, the 4, and plus 3 R. R for, once again, rheumatoid nodules, and R for radiologic, means the Roshan, my dear, erosion, and R for rheumatoid factor, 3R is really important, my dear, and that should be presented more than 6 weeks, and Morical 4/7, the diagnosis, my dear. Yes, my dear doctor, now I'll discuss the rheumatoid arthritis diagnostic criteria. The NICE have stated that clinical diagnosis is more important than the criteria such as those defined by the American College of Rheumatology. 2010 ACR criteria, the target populations, patients who have at least the one joint with definitive clinical synovitis and with the synovitis not better explained by another disease. Classification and criteria for rheumatoid arthritis at score of categories A to D, a score of 6/10, circle the 6/10, my dear, is needed, definitive rheumatoid arthritis. So the keys are RF for the rheumatoid factor, and ACPA is an anti-cyclic citrullinated peptide antibody. A for joint involvement, circle the A, circle the joint involvement. I said A for arthritis, my dear, so that you can remember. Scoring, if it is 1 large joint, you'll get the score for 0. 2 to 10 large joints, you'll get the 1. So circle the 1, large joint 1, and right hand side 0, circle 0. 2 to 10 large joints, score will be 1, circle the 2, and 1 to 3 small joints with or without involvement in the large joints, you'll get the score 2. So here the circle 3 small joints, circle the 3, and 4 to 10 small joints with or without involvement in the large joints, so circle here the 4, you'll get the 3, and the 10 joints, at least the 1 small joint, circle the 10, you'll get the 5, my dear. So once again, under the heading of the scoring, you circle the 1 large joint, circle the 1, 2 to 10 large joint, circle the 2, 1 to 3 small joint, circle the 3, 4 to 10 small joints, circle the 4, and 10 joints, circle the 10 right here. And next is the serology. At least the one test result is needed for classification. So the B for serology, I'm saying the B for virology, my dear. Yes. So negative rheumatoid factor and negative ACPA is a 0, low positive ACPA is a 2, and high positive, you'll get the 3, my dear. So circle the low 2 and high 3, my dear. And the acute phase reactants are, that is one test result is needed for classification, like the normal CRP and normal ESR is 0, abnormal CRP and abnormal ESR is 1, my dear. And D for duration of the symptoms, less than 6 weeks is 0, more equal 6 weeks is the 1, my dear. So yes, my dear doctor, what I'm saying, this is box that I'm writing here, this is very much important, this is box, the new diagnostic criteria. Yes, my dear. Provided the old diagnostic criteria, the symmetrical polyarthritis, small joints of the hands. So actually why the new diagnostic criteria? Because sometimes we have seen the large joints are also involved in case of rheumatoid arthritis, but this is rare. So we need to include the large joints. Otherwise, if you go to the old criteria, it is said the symmetrical polyarthritis, the small joints of the hands, only the hand small joints. But what about the large joints? So that's why the new criteria included the large joints, a bit of scoring, so that we can make the diagnosis of rheumatoid arthritis, including at least one large joints. So yes, my dear doctor, that's why we made the rheumatoid arthritis diagnostic criteria. So the box is the RA diagnostic criteria. If I'm writing the diagnostic criteria, the box, my dear. So in that case, that we will write down the A, B, C, D, my dear. So A for write down the arthritis. I'm writing the arthritis. B for virology. Yes. And C for CRP. And ESR means the inflammatory markers. And D for duration, my dear. If I'm writing the D for duration. Yes, ma'am. So this is the one of the important box, my dear, that you are writing here. The box for the rheumatoid arthritis, the new diagnostic criteria. Yes, my dear. So A for arthritis, say with me. B for virology, so that we can remember. C for CRP, and D for duration. And it said that the diagnosis, everything should be, this is very much important, the 6/10, my dear. The diagnostic criteria, the definitive diagnosis, you can say whenever the scoring is the 6/10, my dear, more than 6/10. And another box for the arthritis that I'm writing, that's really important. If you write down for the arthritis box, because you need them sometimes whenever the score is really needed, sometimes the scenario will be given, so that you need to make the scoring, my dear. So arthritis, if you write down, this is very much important. 1, 2, 3, once again, 4, and 10. So write down the 0, 1, 2, 3. This is very much important. And 10 is a 5, my dear. So if you write down the way that I'm writing, my dear, that will be really helpful. Yes, my dear. So this is the arthritis box, that the 1, 2, 3, 4, 10 and 0, 1, 2, 3, 4, 3, 5, my dear. So if you write down, immediately after that you can make your score, my dear. So this is the one thing that in your box, my dear, there is a rheumatoid arthritis diagnosis, the A, B, C, D for arthritis, B for virology, C for CRP and ESR, and D for duration, definitely duration, the 6 weeks, my dear. So knowing these facts, you can be able to make the score, and also knowing the facts also, once again, the 1, 2, 3, 4, 10, my dear, and also 0, 1, 2 scoring will be the 0, 1, 2, 3, 5. So write them down and do the scoring if you have the scenario in that way, so that you can be able to, yes, know the score, my dear, and make the diagnosis of rheumatoid arthritis. So yes, my dear doctor, next to the rheumatoid arthritis diagnosis, now I'd like to discuss about the rheumatoid arthritis prognostic features. So yes, my dear doctor, listen very carefully. Just follow me what is written on your notes. A number of the features have been shown to predict the poor prognosis with rheumatoid arthritis. Poor prognostic features are rheumatoid factor positive, circle the rheumatoid factor, poor functional status at presentation, circle the poor, HLA-DR4, circle the DR4, X-ray, there is an early erosions that is written after less than 2 years, means within 2 years, if there is an early radiological changes, so this is really a poor prognosis. So definitely circle the erosion or erosions, my dear. Extra-articular features, circle the nodules, means the rheumatoid nodules, and insidious onset, circle the insidious, the word, and anti-CCP antibodies, circle the anti-CCP antibodies. In terms of the gender, this seems to be split in what established sources state is associated with the poor prognosis. However, both the ACR and the recent NICE guidelines, which looked at the huge number of the prognostic studies, seem to conclude that the female gender is associated with the poor prognosis. So circle the female, circle the poor, my dear. So my dear, listen very carefully. This rheumatoid arthritis is a disease of the female disorders, my dear. So usually the females having the diseases, they have usually in different diseases that you will see, my dear, I'll discuss so many diseases. The disease happened to the female, usually the good prognostic features, my dear. But this is the exception. The disease, a typical disease occurred in female, and typically the females will be the more aggressive disorders, means poor prognosis, my dear. So this is one of the exceptions that we already have learned. So my dear, just I'll make one important box writing here. The box include the rheumatoid arthritis, the prognostic features, my dear. If I'm writing the poor prognostic features, so I'm writing the box here so that you can assess box, my dear. Rheumatoid arthritis, the poor prognostic features, my dear. So poor prognostic. So writing down, yes, my dear, poor prognostic features. So what I'm saying, the rheumatoid arthritis poor prognostic features, if I'm writing the poor prognostic feature, we already learned the 3R. Can you remember the 3R? Like here, we already learned the R for rheumatoid nodule, rheumatoid erosion, and the rheumatoid factor. So if I'm writing once again the R for rheumatoid nodule, R for radiological changes, means the erosion, if I'm writing, and R for rheumatoid factor. These three are the poor prognostic features, my dear. Rheumatoid nodule is nothing but the skin, means the extra articular, means beyond the joint involved in the skin and subcutaneous tissues, my dear. So we are writing the rheumatoid nodule erosion and rheumatoid factor. Rheumatoid nodule plus, we can write down other extra articular manifestations or complications are also associated with the poor prognostic features. And erosion is the radiological changes, so means the erosion, the radiological changes means the erosion, if it happens less than, means within 2 years, my dear, this is poor prognosis. Rheumatoid factor is a serological criteria. The presence of rheumatoid factor is a poor prognosis, my dear. And many titer is also poor prognosis. So rheumatoid factor along with the other antibody, that is the ACPA, we can write down here, yes. So rheumatoid factor with the ACPA, anticyclic citrullinated peptide, presence of this antibody also is a poor prognosis. So along with that, we already learned the poor prognostic features, yes, my dear. Along with other prognostic features that I'm adding here, if I'm writing the another R, so R for I'm writing poor. So you see the last R, definitely. The poor functional status. The functional status of rheumatoid arthritis is also measured by some criteria. yes, sometimes the Bars die criteria that is really not needed for you in this moment, means the part 1. So yes, some of the functional status scaling and scoring system is also available. So poor functional status at the presentation is a poor prognostic features, my dear. So you can write down the poor, and also HLA DR4, if I'm writing DR4. So here's once again the R, so you can write down. And also the onset, if I'm writing the poor onset or insidious onset, if I'm writing once again, onset means the insidious onset, means the poor onset. You can write that the poor onset means the insidious onset. So altogether, another 3R is a diagnostic criteria that you can add, my dear. So three diagnostic criteria. And the last, this is exceptional, is a female is a poor prognostic features, my dear. This is added newly. So that's why this is a separate thing, so that you need to remember, my dear. So the poor prognostic features that you need to, yes, my dear, as I said, that you need to remember the rheumatoid arthritis, the poor prognostic features, the R, my dear, the rule of R. So 3R already we know, the rheumatoid nodules, erosion, and rheumatoid factor. And other 3 R's that we already added here, that is R for poor functional status, HLA-DR4, and the poor onset. So once again, poor functional status, HLA-DR4, and also the poor onset means the insidious onset. But you all can remember all these 3 already, you know the another 3 R that I added. But the most important things, my dear, female. This is another important things that are usually encountered to your exam, my dear. So the poor prognostic features. So yes, my dear doctor, I already discussed so many things together. So I'd like to summarize now the important points that I added here. So rheumatoid arthritis epidemiology, the summary is really important. So epidemiology that I discussed, yes, my dear, the single word that you can remember, the 1, 3, 4, 30 Americans for 4-Felty syndrome, 4-Felty syndrome. So you should remember that. So the first box that we already learned. Second box, my dear, this is very much important. Rheumatoid arthritis definition. What does it really mean? The single word that you need to remember, chronic progressive. So here, the single word that you need to remember, that is erosion, my dear. Yes, what I say? The erosion or rosing or erosing is the single word that you need to remember for the rheumatoid arthritis. And the third box is really important here. The symmetrical polyarthritis, small joints of the hands, and the morning stiffness, if the patient comes up. So the diagnosis is the rheumatoid arthritis and psoriatic arthritis. So how to differentiate in between these 2 diseases that we already learned, my dear. Means the rheumatoid arthritis, rheumatoid nodules, and psoriatic arthritis, the psoriatic skin rashes, my dear. So that's it. And third important box, the diagnostic criteria, that is the rheumatoid arthritis. That is the 4 important points, the symmetrical poly, small joints of the hands, and the morning stiffness, with the 3 R4 that is important. Rheumatoid nodules, erosion, is the erosion, and rheumatoid factor. This is very much important, mind. And once again, this is, yes, we can write on the 4th important box, and this is the 5th box. Once again, rheumatoid arthritis diagnostic criteria. The new diagnostic criteria. We can add the new diagnostic criteria. The diagnosis is done by the 6x10, the ABCD, so you can remember. And once again, next box, mind, the 6th. The poor prognostic features are the rule of R. There is 3R, and the next 3R is the poor, HLA-DR4, and poor onset, and last is the female, mind. So summary box, once again, the box 1, 3, 4, 30 Americans. Second box is the rheumatoid diagnostic definition is the erosion, and once again that you can add the rheumatoid arthritis, once again the differentiating points, the symmetrical polyarthritis, small joints in the hands, the morning stiffness, the RA and PSA, and next the diagnostic criteria, there is the 4x7, the 3R added with that, and once again the new diagnostic criteria, ABCD, and the poor prognostic features is nothing but another 3R, and also the female, my dear, that you need to remember. Yes, the female is a poor prognostic features, my dear. I hope that, my dear, the discussion of the rheumatoid arthritis, starting with the epidemiology definition, and once again the old diagnostic criteria, and the new diagnostic criteria, and the prognosis. I hope that you enjoyed, my dear. Thank you very much.